Hello everyone, welcome to our next session on Guess the Remedy. So, rather than session, this is a clip. Guess the Remedy. So, today we have a case of a 60-year-old female who has left hemiplegia. This is because she has a right common cerebral artery infarct. There is a ischemic lesion in the parietal and the occipital region. And when I was first called to see her, she was in the hospital ICU. She was unconscious. She was having very high grade temperature. And it was expected that because the ischemia is very um, the blockage is very big and there is a lot of ischemia, we don't expect that the patient will come back from this position. But then from the relatives story where they said that their mother was a very emotional person, and she was very affected if anything happened to any of her family relatives, and she would grieve and be sad and sulk over that for months and years. So this history of grief, sadness, along with the history that she developed this hemiplegic attack after she heard that her husband was diagnosed of cancer, and she was very affected by it and felt that now it is all over. My husband may die. I cannot live without him. I rather die first before he dies. This complete attachment to family and not being able to live and completely dependent on the family. Without them, I cannot live is very classical of the first row of the periodic table. And considering some other symptoms, I gave her nitramur when she was unconscious and in this state. So she improved, she got conscious, she came out of the situation. They put her on a tracheostomy and they shifted her home. They said this is the maximum improvement that can happen. She is slightly conscious. You can take her home if you have more hopes. And then after a few days, her blood pressure started to drop. Her heart was not working properly. There was a lot of mucus in the chest, and she started having cough along with this mucus. So I gave her Spongia. She did well on Spongia. The blood pressure came back normal. The mucus in the chest reduced. Her heart started functioning normally. She was already a known case of diabetes and hypertension. Her blood pressure came back to normal. She became conscious. The tracheostomy was removed. She started talking. She started having oral diet. Drile's tube was removed, but then she could not see. And her hemiplegia also improved a little bit. Little bit of motion in the left leg and the left arm started. This is what is the question that I have for all of you. Now, after this, the patient developed. She started screaming at night and calling her relatives, and she would say that why are you not people not with me? I think you are planning something. I think you feel that now I am a burden for all of you, so now you are trying to kill me. Now maybe you are trying to give me something so that I die. Maybe you are planning something against me. You are trying to kill me, and I am very scared. And she started accusing all her relatives that you are trying to do this to me, you are trying to kill me. And one more thing that was peculiar is, even though her hemiplegia was improving slightly, her right, sorry, the left hand was in this position only. I tried to open it, but it wouldn't open. It would just stay in this position like this. It was just fixed. Whatever you do, it was not opening, and this was very strange. Why is this happening? Other body parts on the left side, lower extremity right, was moving, but this was just like that, not moving at all. She was just keeping that position, and now what happened, her blood sugar level started to drop very drastically. It started to come down to 40, etc. So for this state, what will you give her? So guess the remedy.